hand over the session to Doctor. I'm going to give some brief introduction about Dr. Aditya. Before I'm going to give the introduction, first of all, on behalf of everyone, on behalf of Avana Surgical System, I thanks to Dr. Aditya. Thank you very much, Doctor, to accept.
Thank you. Thanks. It's a pleasure.
Yeah. Thank you very much, Doctor, for your acceptance to host this webinar. Go to the next slide, sir. Next slide, sir. Yeah. Sir, you do it, make it all the presentation. Thank you. Just a brief introduction about Dr. Aditya, where he is practicing and what is his expert, where he is doing practice everything. Dr. Aditya is a senior consultant ortho surgeon, especially he is an expert in foot and ankle surgeon actually. Okay. He has completed his MBBS and MS and the fellowship, especially in a foot and ankle surgery at in the USA. And he is the university topper and was honored with the professor of Ithiraju Memorial Gold Medal for his exceptional performance in the MS orthopedics. And doctor is expert in foot and ankle complex trauma treatments. He has presented numerous scientific papers and is deeply committed to providing exceptional patient care. So that is what about the Dr. Aditya. Doctor is currently practicing in Yashoda Hospital in Hyderabad. If you want to consult, if you want to meet him also, you can go and meet him in Yashoda Hospital. With that, I would like to hand over the session to Doctor. Doctor, you can proceed now, sir.
Thank you for that great introduction, Ramesh Garu.
Thank you.
Hi, all the viewers. Let us understand why we have this webinar and the most neglected and generally the foot and ankle is a complex problem. The problem of foot and ankle surgery is a complex thing, and so we would like to enlighten about the foot and ankle problems and the other things which will really help the viewers to know why we have this and whom to contact and all. So objective is to understand the common causes.
Sorry to interrupt you.
Ankle. Yeah.
Sorry to interrupt you. We'll ask for the group whether we can go in a Telugu normally, sir. Anybody? I think. Yeah. I think everyone is okay with the Telugu, sir. Actually.
English. Yeah. Telugu.
Yeah. You go ahead, sir.
Yeah. Telugu. Yeah. సో ఈరోజు మనం వీల్ అండర్స్టాండ్ ఫుట్ అండ్ యాంకిల్ లో ఉన్న ప్రాబ్లమ్స్ గురించి మనం అండర్స్టాండ్ వీళ్ళు ఆ ప్రాబ్లమ్స్ ఎట్లా వస్తాయి, ఎందుకు వస్తాయి, ఎవరిని కన్సల్ట్ చేయాలి అనేది చూద్దాం. సో సింపుల్ ఎఫెక్టివ్ సొల్యూషన్స్ ఉంటాయి, అంటే సింపుల్ గా చేసే సొల్యూషన్స్ ఉంటాయి, కొన్ని సర్జరీస్ కూడా ఉంటాయి. ఇది మన ఆబ్జెక్టివ్ ఈ రోజు మన వెబినార్ కి. మనం ఎందుకు వెబినార్ చేస్తున్నాం దానికి, ఫుట్ యాంకిల్ మన పాదము మరియు చీలమండ అంటారు తెలుగులోని. సో ఈ మన రోజువారీ యాక్టివిటీస్ అన్నిటికీ వీటి యొక్క ఇంపార్టెన్స్ చాలా ఉంది. బికాస్ ఫుట్ యాంకిల్ లో ఉన్న బ్యాలెన్స్ బట్టే మన బాడీ క్లియర్ గా మన బాడీ వెయిట్ అంతా సపోర్ట్ చేయగలుగుతుంది. సో ద ఫుట్ ప్రొవైడ్ స్టేబుల్ బేస్ అండ్ బాడీ ఫర్ సపోర్టింగ్ ఇట్స్ వెయిట్. అండ్ ఆల్సో ఫుట్ యొక్క షేప్ ఎట్లా ఉంటుందంటే ఫుట్ ఈజీగా షాక్ అబ్జార్బ్ చేసుకుంటుంది. సో ఫుట్ యొక్క షేప్ మన దేవుడు ఎట్లా ఇచ్చాడంటే షాక్ అబ్జార్బ్ చేసుకునేలాగా, ఇంపాక్ట్ బాడీ మీద తగ్గించేలాగా, రన్నింగ్, వాకింగ్, ఇటువంటి జంపింగ్ లని ఈజీగా చేసే విధంగా మన ఫుట్ యొక్క షేప్ ఇచ్చారు. సో ఒకసారి మనం ఫుట్ ఎనాటమీ చూసినట్టయితే మనకి టోటల్ గా మనకి 26 బోన్స్ ఉంటాయి ఫుట్ లో. వాటిని టార్సల్స్ అంటారు, మెటాటార్సల్స్ అంటారు, ఫెలింజెస్ అంటారు. ఇట్లా రకరకాల బోన్స్ అనేది మనకి డిఫరెంట్ షేప్స్ లో ఒక మంచి షేప్ లో మనకి ఫుట్ లో అట్లా కలిసి ఉంటాయి. 26 బోన్స్ ఉంటాయి, చిన్న చిన్న బోన్స్, పెద్ద పెద్ద బోన్స్ కలిపి. వాటిని టార్సల్స్, మెటాటార్సల్స్, మళ్ళీ ఫారింజెస్ అంటారు. ఈ జాయింట్స్ ఒక ఏ రకంగా మనకి ఇచ్చారంటే దానివల్ల మనకి ఫుట్ మొబిలిటీ అనేది, ఫుట్ యొక్క మూమెంట్, పాదం మూమెంట్ అనేది క్లియర్ గా షాక్ అబ్జర్వ్ అయ్యేలాగా, బాడీ వెయిట్ తీసుకునేలాగా షేప్ చేశారన్నమాట. సో మనకి ఇలా చూసినట్టయితే ఇప్పుడు అనాటమీలో మనకి ఏ జాయింట్స్ ఉంటాయి అంటే కీళ్ళు ఏముంటాయి జాయింట్స్ లో అంటే ఇట్లా ఇంపార్టెంట్ సబ్టెల్లర్ జాయింట్ అనే ఒక ఇంపార్టెంట్ జాయింట్ ఉంది. అది లాస్ట్ జాయింట్ బాడీ వెయిట్ తీసుకునే జాయింట్ లో. అలాగే క్యాల్కేనో క్యూబాయిడ్ జాయింట్ అని ఇట్లా మనకి పెద్ద పెద్ద జాయింట్లు ఒక 5-6 ఉంటాయి. చిన్న చిన్న జాయింట్లు కూడా మనకి ఒక 5 దాకా 5, 3, 5, 15 చిన్న చిన్నవి ఉంటాయి అన్నమాట. అట్లాగే టార్సో మెటాటార్సల్ జాయింట్స్, అట్లా చిన్న జాయింట్స్, కొంచెం మీడియం సైజ్ జాయింట్స్ కూడా ఉంటాయి. ఇవన్నీ జాయింట్స్ ఎంత చక్కగా పనిచేస్తాయి అంటే ఏ జాయింట్ యొక్క డ్యామేజ్ జరిగినా ఏ జాయింట్ ఎఫెక్ట్ అయినా అదర్ జాయింట్స్ ఎఫెక్ట్ అవుతాయి. ఓవరాల్ గా వెయిట్ బేరింగ్, వెయిట్ చేసేటప్పుడు, వెయిట్ పెట్టి నడిచేటప్పుడు వీటి యొక్క ఇంపార్టెన్స్ చాలా ఉంది. సో ఇది ఒక్కసారి వీడియో చూసినట్టయితే మనకి ఇంకా క్లారిటీ వస్తుంది. ఇప్పుడు ఈరోజు మనకు ఈ బోన్ టాలస్, టిబియా, ఫిబులా అనే రకరకాల బోన్స్ ఉన్నాయి. సో అట్లా ఆ కింద టాలస్ అనే, అలాగే క్యాల్కి అని మనకి హీల్ బోన్ ఉంటుంది. సో ఇట్లా ఫుట్ లో అన్ని బోన్స్ చక్కగా కలిసి ఒక మంచి జాయింట్ ఫామ్ చేసి, ఆ పైన కార్టిలేజ్ అంటే మృదులాస్థి అనే ఒక గుజ్జు లాంటి పదార్థం ఉంటుంది ప్రతి జాయింట్ కి. దానివల్ల మనకి మూమెంట్స్ వస్తాయి.
తమిళ్ సార్, తమిళ్
Sir, this
hello.
program is, sir, sorry to interrupt you.
Yeah, no problem. Shall we continue English?
Sir, you
okay?
continue better in
Telugu.
both the things, sir.
English, sir.
Okay.
English will be better, sir. So everybody can't know the Telugu. English, if it is better, preferable,
Yeah,
sir.
okay, no problem. Yeah, no problem. We'll mix both. No
సార్
problem.
తమిళ్ సార్, తమిళ్
Sir, Tamil,
No,
it's
Tamil,
not, because
sorry.
this is especially doctors from Hyderabad not able to speak in Tamil. Okay.
So video is not visible.
Doctor, your video is not there. Maybe you can.
It's playing here.
No, sir. You can on the camera.
సార్, ఐ యామ్ తమిళ్ సార్.
Sir, we will arrange a separate program for Tamil because it is regional wise. We are planned actually for Tamil. This is for the Telugu.
Okay,
You can listen.
so,
You can understand, sir.
Yeah. So you can. So now we'll know, and we'll know ఎందుకు ఫుట్ అండ్ యాంకిల్ ఇంజరీస్ అంటే వాటి యొక్క కామన్ గా జరుగుతాయి అనేది. సో వై ఫుట్ అండ్ యాంకిల్ ఇంజరీస్ ఆర్ కామన్. సో వై బికాస్ మనం అందరం వి వాక్ ఎ లాట్, మనందరం మన పాదం మీద, ఫుట్ మీద నడుస్తాము. సో దెర్ ఇస్ హై యూసేజ్ అండ్ లాట్ ఆఫ్ స్ట్రెస్ ఇన్ ఇట్. సో ఎనీ ప్రాబ్లమ్ ఇన్ ద బోన్స్, ఎనీ ప్రాబ్లమ్ ఇన్ ద ligaments, ఎనీ ప్రాబ్లమ్ ఇన్ ద బోన్ కనెక్షన్స్, జాయింట్స్, ఇట్ విల్ కాజ్ ప్రాబ్లమ్. అండ్ ఇట్స్ ఎ వెరీ కాంప్లెక్స్ స్ట్రక్చర్. యాజ్ ఐ టోల్డ్ యూ, చెప్పాను కదా, చాలా కాంప్లెక్స్ గా ఉంటుంది. 26 జాయింట్స్ ఉంటాయి, చిన్న చిన్న జాయింట్స్, పెద్ద పెద్ద జాయింట్స్ అన్ని కలిపి. ఫుట్ లో మొత్తం రకరకాల యాక్టివిటీస్ చేస్తాం. డే ఇన్ డే అవుట్ మనం రోజంతా ఫుట్ మీద నిలబడతాం, రోజంతా అన్ని పనులు దాని మీదే చేస్తాం. సో ఈ యాక్టివిటీస్ చేయడం వల్ల మనం దెబ్బ తగలొచ్చు, ఇంజరీస్ అవ్వచ్చు. అట్లా కాకుండా పూర్ ఫుట్వేర్, సరైన చెప్పులు వేసుకోకపోవడం, సరైన షూస్ వేసుకోకపోవడం, బూట్లు వేసుకోకపోవడం, ఇవి కూడా ఒక ఇంపార్టెంట్ రీజన్ కింద మనం చూడాలి. ఎందుకంటే సరైన షూ లేకుండా, వేసుకోకుండా నడిచినట్టయితే ఫుట్ మెకానిక్స్ దెబ్బతిని వాడిని కూడా రావచ్చు. అట్లా కాకుండా ఏజ్ రిలేటెడ్ ఫ్యాక్టర్స్ ఉంటాయి. ఏజ్ రిలేటెడ్ గా మనకి బోన్స్ లో వీక్నెస్ వచ్చి ఆస్టియోపోరోసిస్ అంటారు. వాటి వల్ల కూడా బోన్స్, చిన్న చిన్న బోన్స్ విరిగే ప్రమాదం ఉంది. అట్లా కాకుండా వాటి వల్ల కూడా మనకి ఇబ్బంది రావచ్చు. ఇది కాకుండా దేర్ ఇస్ అండర్లైన్ హెల్త్ కండిషన్స్, షుగర్ ఉన్న వాళ్ళకి కానీ, రుమటాయిడ్ ఆర్థరైటిస్ అనే ఒక కీళ్ళ వాతం అనే జబ్బు ఉన్న వాళ్ళు కానీ, ఒబేసిటీ వల్ల కానీ, వీటి వల్ల కూడా ఫుట్ లో ప్రాబ్లమ్స్, ఇంజరీస్ వస్తాయి. So it's estimated that about 20-30% of general population may experience some form of foot and ankle problem. All of us, I think most of the people ikkada unna vallandaru kuda some time of their life they would have experienced some heel pain, some foot pain, something like that. Evadu a pain leni vallu evaru undaru, almost all of us. So especially among people with diabetes, sugar ఉన్న వాళ్ళు అయితే ఇంకా ఎక్కువగా చూస్తాం, అండ్ విచ్ నీడ్స్ లాట్ ఆఫ్ కాంప్లికేషన్స్. చిన్న ప్రాబ్లమ్ తో స్టార్ట్ అయ్యి మేజర్ కాంప్లికేషన్స్, ఈవెన్ యాంపుటేషన్స్ కు ప్రమాదం. So foot and ankle pain is a common complaint, affects all people of all ages, and knee pain along with that, it's common, but it's for foot and ankle pain is more common. Am I audible and visible? Hello?
Sir,
Yes, you are audible.
You are audible.
Yes, sir. Yes, sir.
Well audible, sir.
And there are some audience
Camera is
which
not
are
visible.
complaining that their screen is not visible.
Sir, your screen is visible. Make it a full screen, sir. Make it full
Yeah, I'm
screen.
making it full screen.
And your video only is not available, sir.
My video, oh, that's fine. So my video won't be visible now, na? You will sharing on the screen.
Maybe your image is not there. Only image picture is there. Your camera is not on, sir.
My camera is not on. Oh, okay. I'll switch it on. No problem. Oh, yeah, I got it. I'll switch it on. Now it's okay, right?
It's fine, sir. Now.
Yeah. So we'll go ahead. So as you need for any single thing of importance, there are multiple reasons. So the first foremost important మనకు తెలుసుకోవాల్సిన important reason is why we have this foot and ankle problems. Reason, the most important problem of foot and ankle problems is, most important thing is foot and ankle problems is diagnosis అనేది చాలా ఇంపార్టెంట్. ఈ ఎందుకు వస్తుంది పెయిన్ అనేది తెలుసుకుంటే సగం హాఫ్ ఆఫ్ యువర్ ప్రాబ్లమ్స్ ఆర్ గాన్ అండ్ హాఫ్ ఆఫ్ యువర్ ట్రీట్మెంట్ ఇస్ గాన్. సో ఇదే మోస్ట్ ఇంపార్టెంట్ ఫుట్ అండ్ యాంకిల్ లో. ఈ ఇమేజ్ చూసినట్టయితే మన పాదం ఒక సైడ్ నుంచి చూపిస్తున్నారు. ఒక సైడ్ నుంచి ఒక్కొక్క డాట్ కూడా ఎక్కడెక్కడి నుంచి పెయిన్ వస్తుంది, ఎక్కడెక్కడ ఆ డాట్ లో పెయిన్ ఉంటే ఏంటి ప్రాబ్లము, ఈ డాట్ లో పెయిన్ ఉంటే ఏంటి ప్రాబ్లము, అలాగే గ్రీన్ డాట్ దగ్గర పెయిన్ ఉంటే ఎటువంటి ప్రాబ్లం వస్తుంది. సో ఈ పెయిన్స్ సోర్స్ ఐడెంటిఫై చేయడానికి ఫుట్ పెయిన్ చార్ట్, దీనిలో క్లియర్ గా మనకి ఒక క్లియర్ ఐడియా వస్తుంది. ఎక్కడి నుంచి ఇక్కడ పెయిన్ ఉంటే దిస్ ఇస్ ద సోర్స్ ఆఫ్ పెయిన్. సో దిస్ పెయిన్ ఇస్ దేర్, దిస్ ఇస్ ద ప్రాబ్లమ్. దిస్ పెయిన్ ఇస్ దేర్, దట్ ఈస్ ద ప్రాబ్లమ్, సంథింగ్ లైక్ దట్. సో అట్లాగే దిస్ ఇస్ వన్ సైడ్. దిస్ ఇస్ అదర్ సైడ్ ఆఫ్ ది ఫుట్ వేర్ ఆర్చ్, యూ కెన్ సీ ద curve in the under the foot, that is called arch of the foot. So ఈ వీటిలో ఎక్కడ పెయిన్ ఉన్నా దాన్ని బట్టి we can come to a conclusion or can come to a conclusion that this is the problem. ఇది diagnosis. So diagnosis is very important, especially in foot and ankle. పెయిన్ సోర్స్ తెలుసుకోవడం. అలాగే ఫోర్ ఫుట్ అంటే ముందు పార్ట్, పాదంలో ముందు పార్ట్. సో దీనిలో కూడా మనకి ఎక్కడెక్కడ పెయిన్ జనరేటర్ బట్టి మనం చెప్పే అవకాశం ఉంటుంది డయాగ్నోసిస్. So after that we come to this thing called common foot and ankle problems. We'll see what are the commonest problems that we face in daily things. First, these are the common things. కామన్ గా మనం చూసేది, చాలా కామన్ గా మనం చూసేది, పరిగెట్టేటప్పుడు కానీ ఆడేటప్పుడు కానీ ఏదైనా కూడా స్ప్రెయిన్స్ అంటారు. కాలు మెలిపడిందండి అంటారు, కాలు మెలిపడింది అంటారు, కాలు స్ట్రెయిన్ అయింది అంటారు. ఇట్లా అది అలా కాకుండా ఫ్రాక్చర్స్, బోన్స్ విరగచ్చు, చాలా ఇంపార్టెంట్ అది. ప్లాంటార్ ఫేషియట్ అంటే మడమి నొప్పి, ప్లాంటార్ హీల్ పెయిన్ అని కూడా అంటారు దాన్ని. అట్లా ఎకిలిస్ టెండినోసిస్ అంటే పోస్టీరియర్ పెయిన్, మడమ వెనకాల వచ్చే నొప్పి. బనియన్స్ అంటే కాలు కాలు యొక్క బ్రొటన్ వేలు ఒక పక్క వంకర పోవడం, దానివల్ల ఒక పక్క నొప్పి రావడం. అట్లా కాకుండా గౌట్, బాడీలో యూరిక్ యాసిడ్ అనే కంటెంట్ ఒకటి ఎక్కువ అవడం వల్ల దేర్ ఇస్ సంథింగ్ కాల్డ్ గౌట్, దీనివల్ల కూడా మనకి పెయిన్స్ వస్తాయి. అలాగే ఫ్లాట్ ఫుట్, ఇందాక చూసినట్టు ఇప్పుడు ఈ రైట్ పిక్చర్ లో కనిపిస్తున్నట్టు ఆ కింద ఆర్చ్ ఏదైతే ఉందో, కింద కర్వ్ లాగా ఉన్నది, అది పోతుంది కొంతమందికి, దాన్ని ఫ్లాట్ ఫుట్ అంటారు. అది కూడా ఉండే, ఇవన్నీ చాలా కామన్ గా చూసే ప్రాబ్లమ్స్. సో అసలు స్ట్రెయిన్ అంటే ఏంటి, స్ప్రెయిన్ అంటే ఏంటి చూద్దాం. ఎక్కడైనా స్ట్రెయిన్ అంటే మజిల్ యొక్క ఇంజరీ అని అర్థం, స్ప్రెయిన్ అంటే లెగమెంట్ కానీ లెగమెంట్ ఇంజరీ అని అర్థం. లెగమెంట్ అంటే ఏంటంటే రెండు బోన్స్ ని కనెక్ట్ చేసే ఎలాస్టిక్ బ్యాండ్ లైక్ స్ట్రక్చర్. సో దేర్ ఆర్ స్ట్రక్చర్స్ విచ్ బైండ్ బోత్ ది బోన్స్ ఆర్ కాల్డ్ లెగమెంట్స్. సో ఈ లెగమెంట్స్ ఇంజూర్ అయితే ఇట్స్ కాల్డ్ స్ప్రెయిన్. సంథింగ్ కాల్డ్ స్ట్రెయిన్, ఇట్ ఇస్ కాల్డ్ వేర్ మజిల్ ఈజ్ ఇంజూర్డ్. అంటే కండ విరిగితే, దాన్ని కండ తెగితే, కండకి దెబ్బ తగిలితే దాన్ని మనం స్ట్రెయిన్ అంటాం. అట్లా కాకుండా స్ప్రెయిన్డ్ యాంకిల్స్ ఆర్ ఆఫ్టెన్ డ్యూ టు యాక్సిడెంట్ లైక్ మిస్సింగ్ స్టెప్ అండ్ రోలింగ్ ఆన్ యువర్ యాంకిల్. మనకి స్ప్రెయిన్ అనేది కామన్ గా యూజ్ చేసేవాడు, ఎస్పెషల్లీ రన్నింగ్ చేసిన వాళ్ళు, ఆడేవాళ్ళు. అదే కాకుండా సింపుల్ గా మనం మెట్లు దిగినప్పుడు కూడా 2 స్టెప్స్ మిస్ అయ్యి కాలు మెలిపడింది అని చాలా కామన్ గా చెప్తా ఉంటారు. దట్ ఈస్ కాల్డ్ స్ప్రెయిన్. అండ్ దేర్ కెన్ బి ఏ పోస్చరల్ మెకానికల్ ఫ్యాక్టర్ దట్ ప్లే ఎ రోల్. సమ్ టైమ్స్ కొంతమంది పాదము హై ఆర్చ్ అంటారు, అట్లాంటి పాదం ఉన్న వాళ్ళు, లేకపోతే వీక్ లెగమెంట్స్ ఉన్న వాళ్ళు కూడా, weak ligaments, there are something whenever there are weak ligaments, you can have something called a sprain commonly. Something like this is called sprained ankle. So sprain అనేది రెండు రకాలు. ఒకటి మన ఈ ఇమేజ్ లో there are images that will show clearly in your left side of the screen. So whenever you see there is sprain, that is called inversion sprain. So foot goes inwards. So this happens when the foot falls inward and the outer ligaments are stretched too far. So the pain appears in the outer side of the ankle. That the red arrow you are seeing in the left image. Something like eversion sprain. The foot twists outwards, which is uncommon, very uncommon, but yet we will see. So this is called eversion sprain. So these sprains can be very problematic, very painful. Sometimes they can cause very disabling. People will not be able to walk for long time sometimes. So and the other problem with this thing is this is common and neglected thing. So if you have an injury in the knee, you will immediately take some rest or something. You will have the injury in the hip, you will take some rest. But whenever you have an injury in the knee, this is also should be treated as a important in the ankle. It should be treated immediately. Seek attention immediately. So if not treated, as this the slide says, it can lead to chronic ankle pain, chronic difficulty and instability. So whenever you have a sprain, the first thing anyone can do this. Anyone give rice. Rice is something called rest. So rest to that part. Whenever there is a swollen part, you always give immediate rest to it and put an ice pack for 20 minutes, at least 20 minutes at a time, 4 to 8 times a day, and give a gentle compression bandage. So if you're not able to do, take a help of a nurse, take a help of some paramedical, gentle compression bandage, which helps to reduce the swelling. And most importantly, elevate your leg with the 2 pillows or whatever it is, 6 to 10 inches above your heart. And usually take mild painkillers, very mild painkillers. Rest is extremely important. If the sprain is severe, usually it will be this more severe. Usually it improves over the time. First few days it improves. If it is not improving, anyway, you have to immediately consult don't take the home treatments, don't go into anywhere. It's important to see a doctor. It's very important. Second important thing is fractures. As you can see in these images, one is an ankle fracture, one is a heel bone fracture. The other thing is a foot fracture. So we have a lot of bones, as I told you, 26 joints and 26 bones in the body, in the foot. So all these are prone to fractures. There are a lot of fractures, and there are also a lot of important sprains, ligaments, which can affect all these bones. So fractures can be problematic because the foot takes the entire weight of the body. The pain will be severe. Sometimes they will be unable to walk. Sometimes they will be able to walk, but it will be painful. So it's important to clearly identify the fracture, and you should know what type of fracture we have. And something like toe fractures, and metatarsal fractures are the long bones that you see in this image, and heel fractures, and something called ankle fractures. So what are the common symptoms? You have immediate pain, very severe pain, bruising, that is swelling around that area. There will be a lot of tenderness, and most commonly unable to put the weight on the injured foot. And especially if ankle joint dislocated, it looks crooked, out of place. The ankle doesn't look like it in its place. So to diagnose ankle fracture, you should see by an orthopedic specialist to assess the severity of the injury and immediately plan for the treatment. It's important to go immediately take an X-ray or something. So or X-ray. Sometimes we take a musculoskeletal ultrasound. Sometimes we take CT scans. Weight-bearing CT and weight-bearing X-rays are also commonly taken to diagnose the X-ray fractures and ligament injuries. So as I told you, these are the common treatment options we have. And something like a sprain itself, here also any injured part, you immediately take immediate rest. It's important to take rest. Put an ice pack around it, and gentle compression with some crepe bandage or something, and elevation is important. There are the different options available, and we'll give initial treatment will be in the form of painkillers and some antacids and some kind of anti-swelling drugs and all. And sometimes, most of the time, sometimes the treatment will be a cast that is seen in the X-ray. You put a cast around that thing and make you not put a weight on it. And sometimes we give something called as air boot walker, which is seen in the right side. That walker will help to immobilize, and sometimes we'll able to walk on it with minimal pain and swelling. And yes, sometimes we offer surgery for some instability and very difficult, very displaced fractures. Yes, surgery will be a very good option for these fractures. This is called bunion or hallux valgus. You can see the toe which is deformed. Big toe will be angled outwards and rotated inwards. There will be a prominent bump called as bunion on the inside. That is why it's called bunion. So this is also very painful. And when it's severe, a mild bunions can be treated without any problem. But when the bunion is severe or hallux valgus is severe, you need to wear a special shoe, something like that, which prevents irritation of that bump. Otherwise, most of these people will come to us with difficulty in using a footwear. That is a very important problem. So the causes of bunion are not really great to know, but there are some causes like flat feet and narrow footwear, which is very common in a lot of women and all, and foot injuries, traumatic bunions, and something called inflammatory arthritis. We have that rheumatoid arthritis. Some people will have rheumatoid, which can cause bunion. Something like neuromuscular disorders like cerebral palsy and Ehlers-Danlos syndrome like genetic disorders. So these are possible causes, but it's important to rule out the cause and also treat the bunion. And most of these can be treated with minimal things. A bulging bump on the outside of the foot of big toe, swelling, redness, soreness, and corns and calluses may develop in the first and second rub each other. Ongoing pain, the pain that comes and goes with a limited movement. And possible treatments, as I told you, most of them footwear modifications. We use a white toe box shoe. Orthotics, sometimes we use called hallux valgus splint, which can help you in something. And protective padding, physical therapy. And the permanent correction you will only achieve usually by the surgical procedures. So the next is called plantar heel plantar fascia or lower heel pain, the plantar heel pain or the heel pain. So the heel pain can be on the underside of your heel pain can be on your backside of your heel. The pain in the underside of your heel is called plantar fasciitis or plantar heel pain. So what is plantar fascia? It's inflammation of a band or a tissue that connects the heel bone to the toes, which is causing pain. So you can see the red mark in the image, which is causing this thing. So you can see this video about the plantar fascia. So this is a white band. You can see it is attached from the heel bone and goes all the way to the toes. It's a tight band. So it helps in shock absorption. It helps in shock absorption. It takes the force of your feet. It takes the shock of the feet, and it maintains the arch of the feet. So it's very important to maintain the shape of the feet. Plantar fascia is a very important structure. So whenever there is some kind of trauma to it or some kind of irritation to it, it causes pain. So the site where the plantar fascia attaches to the heel bone can cause a lot of pain when there is irritation or inflammation around that part. So what causes it? We all know. So there are most common causes here usually is an obesity, BMI over 27, which is very common association with plantar fascia because the fascia takes entire weight. The second thing is a poor biomechanics. People having an flat foot, people having high arch foot, something like that. So these people are very much prone to get the plantar fasciitis problem. So these are the important facts and symptoms. Pain at the bottom of the foot under the heel, pain worsening in the morning after getting out of bed after a long period of rest. However, pain subsides with few minutes of walking. It becomes better. So as I told you, excessive training, flat feet, high arches, overuse, unsuitable footwear, medical conditions, and overweight are the major risk factors for the plantar fasciitis. So these are the very important braces which are very useful, especially in the early stages of plantar fasciitis, which helps in stretching the fascia. The main treatment for the plantar fasciitis, the mainstay is stretching the fascia. So these braces, which help in stretching the fascia, will help in relieving the pain. So the medication helps to some extent. Physical therapy, which is extremely important, especially in the plantar fascia, and in acute conditions. Acute means in the conditions where your pain is within 1 week or 2 weeks. Then these night splints, these are very useful and very helpful. Similarly, some kind of orthotics also help, and injections also we nowadays doing ultrasound guided injections which will target the entire plantar fascia in correct painful form and correct pain region. And the other thing is surgery is a rarely done thing, probably in 1 in 100, something like that, but it will be offered in very very chronic cases, which means there is years or years where the surgical options will be offered. This is called posterior heel pain or pain behind your heel. This is called Achilles tendinitis. So Achilles tendinitis is mostly commonly we see in something called degenerative disease in old age people. The second common thing is we see in the athletic population of sports people, where there will be small tears in the tendon or muscle behind your heel, that is called as Achilles tendon. Small tears in the heel can cause pain, inflammation, which is very very disabling. So as you can see the image in the Achilles tendon, and the symptoms are severe pain after in a day after exercising, and thickening of the tendon, pain and stiffness along the tendon in the morning, and pain along with the tendon on the back of the heel which worsens with activity. The bony spurs which with only insertional tendinitis, swelling that is present at the time which gets worse throughout the day. So these can be problematic, especially when wearing the shoes. They can rub the heel with the shoe and cause a lot of problems. So this how to treat this. See, as you can see, he's pointing out the pain. That is insertional Achilles tendinosis. So the other important thing is gout. Gout is, as I told you, it is increase in the serum uric acid, which leads to the deposition of the crystals, something called as uric acid crystals in the joints, and which mainly affects the great toe first, which characterized by sudden severe attacks of pain, swelling, redness, tenderness in one or more joints, most often in the big toe. The problem is stage 1, you have high uric acid levels in the form of crystals, acute gouts, symptoms starts occur causing painful gout attack. Intracortical gout is periods of remission between the gout. Chronic gout is gout painful. The acute tophi are the small crystal-like structures which are deposited in the joints and under the skin. So what are the symptoms? Intense joint pain, very discomfort, extreme discomfort, inflammation and redness without any warning signs. Suddenly it comes, and limited range of signs. If you experience sudden intense pain in the joint, immediately call your doctor. Most of the times it is gout. That goes untreated can lead to gout, which is untreated can lead to joint permanent damage, which may need further surgery. So medical care attention is very important. Controlling the uric acid is very important, which can be disabling otherwise. When to see a doctor? So flat foot. Flat foot, as I told you, the image is very clear. You see a bend or an arch under your feet, which is not present. This is called flat foot. What is the problem with if you have flat foot, if you don't have an arch? So entire mechanics of the foot changes. So whenever you have flat foot, the flat foot without the arch, the body won't take full weight. The body's center of gravity changes. Our foot will take a lot of load. So whenever the foot normal shape is lost, the biomechanics or the mechanics of the foot changes, and the way you walk changes. So it affects from the feet to the knee, even the hip and spine. So having flat foot is a condition where one or both feet no arch. When you stand on pads of the feet, press on the ground. So all babies will have flat foot. Don't worry. After age of 6, they have some kind of flat foot. 2 out of 10 children still have flat foot as adults. Sometimes they have flat foot aren't a problem in most people. If flat foot causes pain in other problems, treatments can help. So this is called a flexible flat foot and rigid flat foot. So whenever you put weight, the arch is not visible. That is called flexible flat foot. When without putting the weight, you can see the arch. That is called flexible. In rigid flat foot, all the times you don't see the arch. So rigid flat foots will cause problem in the future most of the time. Sometimes need surgery, and pain and discomfort in the feet and heel pain. You can get swelling around the ankle. You can get difficulty in standing. Shoes that wear out easily, and lower back and hip and knee pain. So what are the causes? Most of the times it's genetic, we don't know, and injuries can cause it. Obesity is a very important flat foot cause, especially in the adults. Aging and obesity is common when you have adult flat foot. Pregnancy can cause it. It can cause an adult flat foot, but it usually recovers. Your doctor will observe your feet from the front and asking you to stand. This is how the diagnosis is done. Imaging can help to diagnose the pain. And usually, if it is flexible and it is early, usually the treatment is very much orthotics, physical therapy, stretching, everything, non-operative treatments. And operation will be offered in the case of a severe case of flat foot, severely deformed flat foot. So wearing the right shoe is very important. Always select a right shoe, and always only wear cloth shoe for leisure activities, and keep a pair of regular sneakers for the regular going arounds, and wear heels with broad base for the support. And few tips to select. These are the few tips to select. So, and it's important to select the right shoe and check your feet every day. This is very useful for diabetics patients. Check for the sores, blisters, corns, and calluses. Check with a mirror. It's important to see with a mirror. Very important. Diabetics should take care of the feet daily and wash their feet with a warm water, not cold, not dry, not very hot. Never go out with a barefoot. Diabetics should never go out with a barefoot. Wear the shoes that fits well, with good room in it, and trim your nails straight across, smooth, sharp edges with a nail file. Don't try to trim your corners. This is very important, especially in diabetics. So don't try to remove the constant calluses by yourself, especially diabetes. Get your feet checked at every healthcare you visit. Foot to doctor is very important. So diabetes, especially for the diabetes. Talk with an orthopedic doctor who specializes in foot and ankle treatments. That may help you to get back to the pain-free walking. This is that would be the right treatment for you. Thank you. Thanks to all.
Thank you very much, Doctor, for your wonderful presentation. You are explained all the indications in a detailed manner, which are the most common foot and ankle problems. Because this is very new to our audience, maybe maybe a lot of new indications may be very new to them, and what is the treatment option also you are explained in detail. Thank you very much, Doctor. I will ask one by one to talk to you. 1 minute, sir.
Sure.
Small request to everyone, if you want to talk to the doctor, please raise your hand so that I will allow one by one to talk to the doctor. Shobha madam, you want to ask to the doctor? Sir, you stop listen, sir.
Yeah.
Now you are. Madam, you want to talk to doctor now? If you have any question, please ask to the doctor now. Doctor will explain everything. From the audience, any questions to doctor? If you want to understand, want some clarification from the doctor, please, you can talk to the doctor now. Unmute and talk. Hello. Is there any question
Yes.
from the group? Yeah.
డాక్టర్ గారి కోసం ఏమైనా క్వశ్చన్స్ ఉన్నాయా మీ దగ్గర?
Sir, normally in your current
Mhm.
practice, what is the common
Yes.
indication you are seeing out of this
Yeah.
indication?
That's what. So the common thing that we see is a plantar heel pain or plantar fasciitis. So that
Okay.
is extremely common in my practice. Second thing is sprains,
Okay.
apart from fractures and all. So the heel pain is a common scenario in our thing. The most common thing I see is most of them will have flat foot or something like that. The second common thing is they walk barefoot for long. Suddenly they stop gymming, running, something like that. So they strain out a lot. So that is the most common reason I find out. So they start gymming and all a month back, then improper footwear. So that would usually cause a lot of weight on the heel and all. So that is a common scenario that we see.
Okay. Thank you, doctor. One more thing, sir. Especially
Mm.
when it comes to the plantar fasciitis, you said it is very quite common. But
Mm.
how to differentiate this pain? Because we thought it is a normal heel pain.
Yes.
But how should we differentiate this plantar fasciitis pain?
Yeah. See, the plantar fasciitis pain is very clear. Usually, the most common, as we presented in our seminar, the pain which aggravates in the morning, especially the first step, is very painful. That is a common presentation, and it improves over the time. In some people and some set of people, it won't improve, but in some people, definitely it will improve. That is the commonest presentations. But the common mistake that we do is most people don't tell us that they are walking on barefoot or running something like that on a barefoot something. So you might have a something called a calcaneal stress fracture or heel bone stress fracture. This is commonly misdiagnosed as a plantar fasciitis. That is what I commonly see. So when athlete comes to me, I don't first diagnose that as plantar fasciitis. See, the athletes and all the runners and all will have calcaneal stress fractures. Though, so that is a common misdiagnosis. So that pain usually increases after your stress. That won't come down after your stress, after walking or something. This pain usually improves better after walking. So when the pain is not becoming better after walking and all, usually it amounts to some kind of stress, like calcaneal stress or something related to neurology, something from the nerves or something like that.
Thank you, doctor. Is there any particular age plantar fasciitis or even tendinitis will be very common?
Yeah. So plantar fasciitis is common, especially in the obese people. So why? Because as the age progresses, sometimes if especially we are overweight, the tendons starts to degenerate and they don't work well. So whenever the tendons doesn't work, what happens? Your foot shape changes. So whenever your foot shape changes, sometimes it leads to flat foot. So whenever that happens, the heel pain starts. So that is a secondary effect. The plantar fasciitis is a secondary effect of biomechanical problem. So usually in middle age but nowadays we are commonly seeing it in the young age too. The most other common reason that I see is vitamin D deficiency. So people will have vitamin D deficiency over which they start walking or start gymming or whatever it is. Some start doing suddenly, you will get that pain.
Okay. Thank you, doctor. Sir, what are the, is there any any surgery option is there, or we can go for a conservative treatment?
Yeah. So there are a lot of variety of treatments for that. The most common prescribed treatment as I practice now is a stretching exercise. So stretching exercise improves all kinds of plantar fascia pain. It should come down in next to 3 to 4 weeks. If we properly guide a physio to do a proper physiotherapy, with a stretching exercise like calf stretching, something called as, or plantar fascia stretching. Simple exercise, but that should be done diligently, at least 20 to 30 minutes a day. So if you do that properly with a proper guide of physiotherapy, it should come down. So apart from all the other treatments, this is the main core treatment for the plantar fascia stretching exercise, because we should focus more on that rather than taking medicines and all. And other thing that can help is night, whenever you have that pain, whatever happens is, so the night sprints, yeah, this makes the heel stretched out, and that can reduce the pain. So that is an important thing. The other common is surgery. Surgery is an extremely rare thing. So I hardly do a surgery for plantar fascia, maybe 1 in 100. So surgery is extremely uncommon. It's not really being done every time, but definitely yes. Yeah, surgery is offered as a last resort. Sometimes also we do injections. Nowadays we are doing ultrasound guided injections so that we can target directly in the plantar fascia. The pain will come down, but this injection which we are giving is only a temporary thing. It's not a permanent thing. The pain will come down, but you have to do the stretching exercise which we have spoken.
Thank you, doctor. You mean to say that surgery is not much necessary for the
Not
plantar
much
fasciitis?
necessary. Yes.
Maybe conservatively we can treat the plantar fasciitis.
We can treat
Only
most
thing,
of them. Yeah.
right.
Only
Only thing
one
what
in
you said
100 needs
exactly.
surgery.
Thank you, doctor. What I understood that conservatively we can treat, and the root cause also is more important. Whether we need to diagnose properly,
Yes.
whether it is a plantar fasciitis pain or any other pain.
Yeah. Yes.
Okay. Thank you, doctor. Some more people they are waiting to
Yeah.
ask a question.
Yeah.
Mr.
Sure.
Rajendra Prasad, you are raised your hand. Please talk to the doctor. Unmute and talk to the doctor.
Hello.
Hello.
Yeah, first I want to congratulate the whole team and I want to thank Dr. Aditya. Around 5 months back, actually, that patient also joined now to the meeting. One of my schoolmate, Praveen, he had an injury in ankle. I sent to the Aditya. Recently, just within 1 week back, he went 5 km run.
Thank you.
Actually, I have a doubt. After the ankle surgery, how much time we have to take to go for this marathon and everything?
Yeah, so it's a good question. Yeah, good question. So
And
ankle
one more
surgeries
question.
take yes.
One more question is, I actually I joined in middle. Regarding gout, most of the patients ask about protein food.
Right, good.
For meat and uh, legumes. If we say stop these things, these foods, one my patient asked me today, can I take fish?
Yeah, good question.
What is the answer? Yeah.
Yeah, thanks for that, Rajendra Prasad. The first question is about your ankle surgery and return to the activity. See, yeah, unlike other surgeries like long bone surgeries like tibia or leg or thigh or something, definitely ankle surgeries take long time to recover, because the blood supply of that region is little less. So we tend to not make them put weight for some long time than normal surgery. So sometimes it takes more than 3 months. Usually what we offer is in 6 months down the line. 6 months down the line, you should be able to do some kind of sporting activity. Some kind of sporting activity is possible in 6 months. Second question is gout. Yeah. In my practice, in gout, see, in our Indian scenario, Indian patients, telling them that don't eat this thing, don't eat that thing is quite difficult to filter it out. So what I generally do is, I generally warn them not to eat non-veg at all. But having said that, fish can be taken in moderate amounts, usually can be taken. But if we say that, they can't filter it out. So it's difficult. So in our gout patients, I generally tell them avoid non-vegetarian at all. Completely non-vegetarian should be stopped. The other thing I tell is completely stopping of alcohol. These two things are very important. Unless you do that, the gout pain keeps on coming back. I hope you answered
Thank
the
you,
question.
doctor. Thank you, sir. Mr. Praveen Rao, you want to ask something? Doctor, yeah, you can speak now.
Yeah, thank you, Rajendra Prasad, for adding me to this link. And thank you, Dr. Aditya, for treating me during my difficult times. And it worked out well for me within this almost 7 months' time. And last week, I was able to complete 5K run within 32 minutes time.
Good, great.
So I don't see any difficulties even after the run, everything. So I feel so excited, and even I'm planning the coming 22nd September. There's a 10K run. I'm planning for that. With
Sure,
good
you
amount
can.
of practice and other things, we can make this.
Sure, thank you. You can.
That's all. Thank you.
Thank you, Mr. Praveen. I think you are really happy to see you in this webinar. Thank you very much. Now you are started running 5K. It is really a remarkable achievement. Okay, thank you very much, doctor, for his achievement. Yeah. Sir, there is a one more person. Ms.
Sure.
Nishi Batkul, you can ask now. You can talk to the doctor. Unmute and talk.
Yeah. Hello, sir. Actually, my son is having a Down syndrome and he is having a flat foot along with the bunny toe.
Okay.
And he is 14 years old right now.
Mhm.
So, can we do something? Right now, he didn't have any problem. He can walk properly and everything. But still, as
Okay.
you told, in the future, he might have some issues. So, what we can do right present to help him out?
Yeah. See, good. Down syndrome babies usually have the muscle is weak for them. There's something called as hypotonia. So the muscles are not strong enough sometimes. So this leads to flat foot in some of them. The question is, if there is no pain, unless the foot is having severe flat, foot is severely flattened out.
Yeah, sir.
Uh,
It's severely flattened out along with the bunny
okay.
toe also.
So you have bunion also, right?
Yeah.
So yeah, see the flattened arch is the cause for the bunion there. So nowadays in children, especially young children, we have something called as arthro-rice screw, which is very minimally invasive surgery that we have came out.
That
Where
is it?
what we do is something called as, I'll tell you in detail. There is some surgery which is minimal invasive surgery, small
Okay.
hole surgery, where we put a
Okay.
small screw in his ankle, which makes
Okay.
his arch better. Okay, it improves a
Okay.
lot than
Mhm.
this, and it looks better, and his mechanics will be better. These are useful, especially in the children, where we don't need to do a big cutting surgeries and all.
So
In
this
adults, we
surgery
don't
we
really.
can do in the Down syndrome kid also because they won't
Yeah,
understand
yeah,
what.
yeah. No problem. In Down syndrome kid also you can do it. It won't have a lot of pain. Even we can make him walk as early as possible.
Okay. Mm-hmm.
So we have a small screw which goes into your ankle, which is a small
Okay.
cut, not a big cut. So it makes it better. I don't say it's 100%, but it makes it better.
So it's better one time I will take him to you and you just have
Sure.
an
Yeah.
observation on him.
Please.
Then we can
Yeah.
go through
Please.
that. What the
Yeah.
surgery
We'll.
name you told me?
Uh, I'll give you a slide at the last. Okay. So
Sure.
you people will know. Okay. My contact and all. Okay.
Yeah, sure, sure. Thank you, sir.
Mail
Thank
address
you
and
so much.
all. Sure.
Yeah,
Uh,
sure.
Thank you, madam. What we will do, we will share the contact details. Maybe if you have any
Okay.
questions, we will pass it to the doctor. Also, we'll give that. We will arrange for a appointment.
Yeah, see, we can add her in our WhatsApp group or something. We have that.
Sure, sir. Thank you so much.
Mr. Venugopal Rao, sir, unmute and speak to the doctor, sir. Mr. Venugopal Rao. Yeah. Okay. Sir, there is a one more question in the chat box actually. I'm searching regularly, but the plantar fasciitis pain is not going away.
Not going out.
What do I do?
Yeah.
Due to the pain, I stopped running.
Yeah. See, plantar fasciitis pain, as I told you, the diligent stretching exercise is very important. I don't know how better you are doing. See, if the pain is not coming down, in spite of that, you are running. That is second thing we should see. If you are running, still pain is not coming down, we should see and get an MRI done sometimes. We have to see are we missing something. As I told you, especially if you're a runner, we have something called stress fractures around the heel bone. So we need to diagnose it. But a diligent stretching exercise, 30 minutes, 20 to 30 minutes, still not coming down. The next step is to give an injection into the heel. That too, not blind. Then I generally give ultrasound guided injection, which clearly targets that part, which will reduce the pain. Still not coming down. The next stage, I'll take a bone scan or MRI, see whether we are missing something inside the bone. And last thing I offer is a surgery. And even now with physiotherapy, we have something called as ESWT, which is extracorporeal shock wave therapy. These shock wave therapies are working like really good. So if you take that extracorporeal shock wave treatment for a few days, sometimes the pain comes down completely. And we need to check your feet, whether the biomechanically your feet is good or not. We have to see the shape of your feet, like whether it's a flat feet or something else.
Excuse me, sir.
Yeah.
So this
Okay.
Yes.
extracorporeal shock wave will give relief for the other pains also, like back pain or something?
No, it is usually for the superficial pains like plantar fasciitis.
So that is not like a normal shortwave diathermy?
It's like similarly like that, but this gives multiple shocks. It causes micro trauma, something like that, and improves the
So,
circulation and all.
so that is the extracorporeal shock wave therapy you are telling.
Yeah.
Okay, sir. Thank you.
Thank you, Bruno. Thank you. And one more thing, sir. There is one more question actually. That silicone insoles is very quite common, especially for the
Yes.
plantar fasciitis pain.
Mhm,
Even
mhm.
nowadays, people started buying from the online itself.
Yes,
Whether it really
yes.
helpful, sir, actually.
Yes. In early stages, especially, and depending upon our heel size, if you are using a shoe, not in the chappal, it is helpful. Yes. But the problem with silicone insoles is they tend to wear out easily. The problem is they tend to wear out easily. So you need to change it every time. They will help for some time. In month time, it comes down and you will have pain comes back again. So it's important to see that you have to change it every time. And rather than that, now we are coming up with a customized insoles where you have a heel cushion built inside the sole inside. So it's better to have a customized insoles rather than pure silicone. But silicone insoles do work, but they wear out easily. That is the only problem with that. Yeah, you can use it. Nothing wrong in it.
Okay. You mean to say that due to the weight bearing, there is a possibility of wear and tear.
Wear and tear,
But the quality also is more important when it comes to the insoles. Thank you very much.
Right.
Sir, Mr. Venugopal, you are raised your hand. If you want, you can please go ahead. Talk to the doctor, unmute and talk to the doctor now. Maybe I think it's not unmute, I think. Sir, there is one more question from the chat box. What are the things to be avoided in gout apart from non-veg and alcohol in vegetarian diet actually?
Yeah, that's a great question. So the problem is in a vegetarian diets, there are a lot of people, vegetarians, who still are suffering from gout pain. One of the important causes is obesity, weight gain, which is very important. So which should be controlled, which is very important, especially if you want to control your gait. And in vegetarian diet, the commonest the vegetarian diets, in medical language, you should say that the purine rich diets. So if you go to the Google search or something, anything, you can type it purine rich diets. So purine rich food should be avoided in the gout, especially in vegetarian. Common thing I say is mushrooms. Mushrooms should be avoided. It's a high purine content, right? Second thing is spinach. These two should be usually avoided. Dairy products can be taken normally, but in a greater extent, sometimes this is also rich in protein, something like a paneer or something. They are also sometimes rich in protein, but purines are not high. So usually vegetarian diets won't really cause that kind of increase in the uric acid. So any food which is rich in purines should be avoided.
Thank you, doctor. What about legumes?
Legumes can be taken. As I told you, vegetarian diets are fine. Legume taken in moderation, legumes are fine. Yes, we can take it.
Thank you, doctor.
So non-vegetarian chicken breast and all, those are red wine. These should be completely avoided. Alcohol and non-vegetarian foods. Not all, but I generally don't filter non-vegetarian, because if you filter it, our Indian patients won't take it.
Really great, sir, actually, because you are given very fantastic advice, actually, especially when it comes to the diet, actually, especially for this foot and ankle. Some certain foods are responsible for the gout and other indications. Thank you very much. And one more thing, is there any diet for plantar fasciitis? Is there anything especially? There is a question from the...
Yeah. So plantar fasciitis sometimes also comes as a part of gout.
Okay.
If that is a problem, then we should do all these protocols. The other important thing is plantar fasciitis, the common cause is the weight gain. So once you lose your weight, your heel pain will be gone.
Thank you, doctor. Thank you.
Yeah.
And there is one more question. Diet, what is the diet we need to include? Because we are talking about exclude certain item. We don't want to add this item. But when it comes to the foot and ankle, to avoid the foot and ankle, which kind of food will be helpful?
Yeah, that's what. Good. So see, foot and ankle is like any part of the body. It has nerves, it has blood vessels, it has everything. So control your sugars. It's important to control your sugar. So sugars should be avoided, especially when you're diabetic. You should be very much careful about your sugar. Sugar control is very important. It's related to the foot and ankle problems. Once your sugar rises, all your feet becomes numb, neuropathy, and all problems comes. So it's important to control your sugar. And which is always include a protein rich diet if you are in an active lifestyle. Protein deficient diet can cause a lot of problems. The other thing is vitamin D deficiency, which is very common in our India. There is also causing a lot of foot and ankle problems nowadays. So include vitamin D rich and protein rich diets. That is important for the foot and ankle.
Thank you, doctor. One more question actually from the chat box. Which extra calcium or substitute should be included in food? I think you are addressed that.
Yeah. Right. Regularly vitamin D intake. It's important to take vitamin D supplements for us, especially when you are 30 and above. Not kids, 20, 25. Nowadays, I'm seeing in 18 too. So, especially you are in 30 and going to middle age, 30, 35, something like that. Vitamin D, including in your substitute, is very important. Take regularly vitamin D pills, minimal dose.
Thank you, doctor. Is there any question, Mr. Paila Venugopal Rao? You are raised your hand for a long time. If you have any question, you can talk to doctor now. Okay. And one more question. Lakshmi Ramesh.
Yes, sir. My name is Ramesh.
Yeah.
Hello.
Okay,
sir, can you hear me?
Hello. Yes,
okay.
Please go ahead, sir.
Actually, see, my age is 53 years. My both the knees got almost degenerated, sir. So because of that, I have severe pain in my ankle. So is there any solution for that?
Usually knees and ankle are not really related, but see, as the knees get worn out, we can by age. Similarly, ankle is also a joint, so they can get worn out with a similar pattern. So depending upon the the amount of ankle degeneration, we offer a lot of surgeries. Something called a fusion, something also injections also we do. So depending upon the problem you have, yes, there are different surgeries. Sometimes simple shoe modification will help you.
Oh, right, sir. No, is it because of degeneration or is there any problem in ankle, sir?
That depends upon I need to examine and see. And that can be a part of degeneration. Yes.
Oh, right. Okay. Thank you, sir.
Yeah.
Thank you, doctor. Sir, how much protein? Is there any limitation?
Yes. Yeah. Anyone in the body, anyone you have to take 1 gram per day. Suppose your body weight is 70 grams. You have to take 70 grams of protein is a minimum thing. 1 to 1.5 gram per day is for moderately working people. Heavy workers like gym and all day, entire day you are doing some exercise or something, you are heavy working, heavy load people should take 1.8 to 2 grams per day. So depending upon your work, so minimum amount is 1 gram per day. That is should be taken.
Thank you, doctor. There is one more question in the chat box actually. Sir, can you please explain about the calf muscle cramps and the reason for it and its management?
Right. Calf muscle cramps, we all experience. So any muscle cramp, any muscle that has a pain, that indicates that it's a cramp is, we call it as cramp is a cry of a dying muscle. The muscle is asking for something. So when it gets a cramp, it's asking for something. So the common reason that we see is dehydration, not taking adequate amount of water. The other common reason is the blood supply is less. The blood is not flowing properly to your muscles, which makes the lactic acid to build up in your muscles and cause a cramp. So the other common things are, especially in diabetes, the vasculitis issues. The blood supply is not there. The other common thing is the muscles are not good enough. They're not fed enough good, like protein deficiency and vitamin D deficiency, which is nowadays we are common. And these are the common reasons that we see. Yes.
Is
So
there any
adequate amount of water? Yeah.
Yeah. Is there any exercise maybe will prevent this cramps actually? Which helps.
First, make sure you get a good protein
Okay.
and good amount of hydration. Whenever you get a cramp, immediately what you should do is you gently stretch it. That is a common treatment for any kind of cramp. Not too fast, not too slow. Very gentle. Slowly, you should get the opposite movement. Simply stretch the ankle, and 1 hour the blood flow restores. Usually, the cramp goes away. Take a lot of water. Take a lot of water. That is important whenever you feel a cramp. And if required, take a mild painkiller.
Thank you, doctor. There is one more question in the chat box. When I sleep on the tiles, my leg getting shocks. What is the reason for that?
I mean, the leg getting shocks is something which is, question is not really clear, but it's not about the sleeping on the floor or something. Usually, when you are not dehydrated, something like that, you'll get that kind of restless leg, something called as vitamin D is deficient, and you're working throughout the day, not taking adequate water, you're not have adequate rest or adequate sleep. This can cause problems.
Sir, one more thing, just I would like to understand from your presentation. The bunion is one thing which is very, very quite common. I think
Yes.
whether it is really people are really giving importance for that bunion or they are neglecting.
Right. Bunions, most of Indians, we wear chappals. We don't wear shoe. So most of us neglect. Why? Because it's not painful until you use a shoe or something. And sometimes we have severe bunions where it's painful even if you don't wear a shoe. So nowadays we are in urban population, we are more and more towards shoe. We are wearing a lot of shoes. So nowadays we are coming in with nowadays the people are coming with me a lot of pain, bunion pain and all. So previously we used to don't, because we use the open shoe or sandals. That won't cause a problem. So bunion causes problem when it rubs your with your shoe or whatever it is. When it's severe bunion, when the bunion becomes so severe, then the joint becomes arthritic and painful. Then they come to us. That is a common indication. So yes, it's better to consult early to do something for the bunion, because there is no big exercise to do relieve the bunion, but you can use splints and wide toe box shoes which can relieve the pain.
Bunions, the reason for that, it is only gout or any other particular reason?
No, bunion has a different reason.
Yeah.
Bunion, the reason is, as we told in our seminar, there's mostly genetic. I see mostly genetic that runs in the families. Yes, gout is also one reason, but not frequently. Genetics is the commonest reason that we see, and the other common reason where the syndromic children, where the muscle tone is not great. So we have flat foot and all, then they do have a bunion. So we can do sequential correction.
Thank you, doctor. Thank you. There is one more question in the chat box actually. Is steroid injections for plantar fasciitis a permanent solution?
Yeah. No, it's not a permanent solution. Definitely not a permanent solution. This is a great question. So steroids, what they do is when they give the steroids into a heel, that reduces the inflammation in your heel. So what happens is the pain will come down. When the pain comes down, you try to do your activities well. So that stretches your plantar fascia and helps in healing. So that is how it works. But it's not a solution for it. It reduces the pain. It's not a permanent solution. When your pain is reduced, you resume your activities. Whenever you resume your activities, the plantar fascia gets stretches out. So the pain comes down. That is the reason for the steroids. So you'll cooperate for physio, the pain will come down. That is the main reason that we give steroids.
Thank you, doctor. Sir, one more question. In my right side knee, injection given the doctor has given an injection is good for me, and how much? I don't know what is that
Yeah.
exactly she is asking.
Yeah,
actually.
probably she is telling about some kind of injection into the knee for arthritis. Yeah, there are a lot of injections that we give injections into the knee for arthritis. They are all okay, they are all good, but none of your injection can be 100% sure. They can help in early stages, but your knee is really worn out, and if you are in the later stages of your knee arthritis, these injections won't really help.
So there is a one interesting question actually.
Mhm.
Should we pull or press the bones when they hurt? Because which is very quite common. You can see that if even any children or anybody fell down immediately, they used to do pull that the ankle.
See,
Yeah,
yeah,
that is
yeah.
what.
The question is, whenever you see an ankle, some whatever it is, a bone fracture or something, what you should do? So first thing is, as a primary caregiver or as a bystander, I don't think you should do anything. You should not do anything. Just immobilize it, put some plaster, put some bandage or something, and leave it until your paramedic comes. So if there is a deformity, the common force is pulling force, not a pushing force. Pushing force is not generally needed. Pulling force is needed if there is a dislocation or a fracture with some kind of crooked deformity or something.
Okay, you mean to say that I think it is not advisable to go for any other
Yes,
immediately
no,
put them in an
no.
immobilizer or kind of things. Maybe
Yes,
put
you
a
always
bandage.
don't do any kind of maneuvers. Just put a crepe bandage or something and make the medical person come. That's better.
Okay. If the patient is having a severe pain, immediately take him to the nearby hospital.
Yes,
Is better. So thank you.
yes, that is a better thing.
Sir, and one more thing, one more question. Using MCR, also heel pain is there. MCR in the sense, I think they are mean to some
Yes,
chapels, I
yeah,
think.
yeah,
What is the
yeah,
best
yeah.
to relieve pain actually?
Yeah. See, MCR footwear do help. MCR means microcellular rubber. So microcellular rubber is something like rubber molecules will be there. Rubber in between each rubber molecule, you have something called as, so in between rubber you have air trapped.
Okay.
So it gives a cushioning effect. So MCR chapels do help in heel pain because they offload your heel. They'll reduce the pain. But that is not a permanent solution. As I told you, stretching is a permanent solution. But whenever you hop around, you are in the home, I do prescribe MCR footwear. The only problem with them is something like silicone itself. It easily wears out. That is a problem. The wearing out is very easy.
Okay.
So
Thank
you
you.
have to change them frequently, every 3 months or something.
Yeah, that is what you in your presentation also you mentioned. Selecting the footwear also is more important.
Yeah.
Yeah. Thank you, doctor. Is there any question from the audience? One more question. Sir, also I wanted to understand about the surgery for plantar fasciitis. It is a permanent solution for the plantar fasciitis.
Yeah. Surgery is a permanent solution for the plantar fasciitis. In surgery, what we do is we'll cut the plantar fascia which is causing your pain. That is the only surgery that is there as of now. So we'll cut it, not completely, partially, which is painful. So only problem with this surgery, sometimes you lose the foot arch. So in long run, now you may have pain relief. In long term, sometimes because of this arch, little less arch, you may have to use a custom orthotic or a shoe for long time.
Okay. So after surgery, how many days normally they need a rest or something? I think he's affected with plantar fasciitis. I think he's worried about that.
No problem. Yeah, plantar fasciitis surgery usually is not a big non-weight bearing surgery. You can right away weight bear. You don't need a lot of rest. Nowadays we are doing endoscopic with small hole in it, so that can relieve the pain. We don't need a lot of rest for it. Until sutures removed, probably 2 weeks rest is required.
Thank you, doctor.
So, doctor, plantar fasciitis physiotherapy is important again.
That's what I told you, madam. So the physiotherapy is extremely important. You have to do stretching exercise. That is my first treatment
Sir,
for
after the surgery.
Yeah, after the surgery. Yeah, even after the surgery. Yes, you have to do.
Okay.
Sir, one more question actually. Can we wear an ankle band when we are standing or walking?
See, ankle bands is something you mean to tell about something like a socks which you wear. So see, ankle bands don't really help in anything. It restricts your mobility. That is the only thing. If you want to restrict your mobility, something like you have pain or swelling around the ankle, you don't want to move the ankle, then probably you should wear a ankle band or crib bandage. Otherwise, normal walking, normal thing, should not wear something like that which restricts your mobility.
Thank you, doctor. One more question. When I get up in the morning, the back of my leg hurts. What could be the reason?
Yeah, back of the leg. So I mean, we presume it is back of your heel probably.
Maybe like Achilles.
Yeah, that's what. So back of the heel, as I told you, is insertional tendinitis. It's insertional tendinitis. So even insertional tendinitis, the first treatment for me is the stretching exercise. That really helps. But in this case, unlike plantar fasciitis, we will advise rest. We will not allow him to run or something like for next 3 to 4 weeks. Plantar fasciitis, we don't really advise a lot of rest, but we'll advise a proper shoe. In this case, we'll advise rest, and while walking, we'll advise them an open shoe which won't rub your feet against the shoe. So open footwear, open back, and stretching exercise should help. And with mild painkillers, and nowadays we have some kind of medications with collagen and all that can also help.
Thank you, doctor. Thank you very much for your wonderful explanation for all the questions. Is there any question to doctor? Otherwise, we'll wind up because already we're getting late actually. Thank you. There is no question from the audience, doctor. I think you have done a wonderful job, doctor. You are explained everything in a very detailed manner, and you are politely explained to all the questions, doubts actually. Suddenly one person raised. SN Reddy, you have any question, please ask immediately because already getting late actually. If you have any question, please raise your talk to the doctor now. Okay, I think there is no question from the group audience. If you have any question, please share it in the chat in the WhatsApp group so that we can pass it to the doctor and we'll share the answers to you. Okay. Thank you very much for joining for this wonderful evening. And on the foot and ankle, because foot and ankle pain also is more important compared to the other knee pain or a low back pain like that. Foot and ankle is also one of the important thing. I think from the doctor presentation, you are understood that what are the various indications, what is the importance of that also. Okay. So thank you very much for joining. First of all, again, from Avana Surgical, on behalf of Avana Surgical, we are really thankful to you, doctor. Really, we are thankful to you, sir. Thank you very much, doctor.
Thank you.
Thanks for joining, everyone. Thank you very much.
Yeah.